Hey, Dr. Ray, welcome back to Ingredients for a Better Life, week 3. Thanks for joining me. How you doing today, Doc?
Doing great. Thanks for having me on, Jay.
Good, good. Thanks for being here. So again, back to the phone consultations and video consultations. Here's a big question from last week. So people are asking, I've either heard about or have experienced side effects from Finasteride and Minoxidil, which is the standard treatment nowadays for hair loss with other companies. And the Stop and Regrow one, do you use those ingredients, and does Stop and Regrow have side effects? People want to know.
Those are good questions, Jay, that I think a lot of people would want to have the answer to, and I believe they deserve to have the answer to. So number one, minoxidil, the molecule we do not use in our program, and the finasteride molecule we do not use in the program. And we explain why, Jay, during the part 1 and part 2 assessment, why those molecules can cause side effects and they will not be effective long term. So both of those molecules are, number one, ineffective, and number two, can cause side effects. So no,
Yep.
Jay, we don't use those molecules in the office. We first run a biochemical report card, and we find out what is the underlying cause, and we review the genetic defects, the nutritional components, as well as environmental components. And once we've fully assessed and understood exactly the cause, we then create the supplement based on the recipe using molecules that are both effective without side effects.
Right, and from what I understand, finasteride's been around for a long time, so there's other ways to do this, and that's from what I understand, they used to use that to treat prostate cancer, and that's not what we're trying to do here, right?
Well, when in the old days, Jay, people were treating cellular diseases, and prostate cells is a cellular disease. And today we're looking at things on a molecular level, and we're treating the molecular imbalances that the cells respond to. Well,
On
Jay, you brought up a very interesting topic. The human body is very complex, as you alluded to. And, 100 trillion cells is the human body. And at first glimpse, it does seem that it could be overbearing, 100 trillion cells. But in our research, we've actually figured out every single atom and the proportion of every atom and every element inside the human body. And we have 61 elements out of the 92 possible elements inside the human body. And we have the fractions of every atom inside the body. So 100 trillion cells seems very overwhelming, but there's only 200 different types of cells. And today we can change the environment inside a chemistry a tube, and we can change the environment and turn a skin cell into a stem cell. So it was never really the cells that were the issue. It was changing the environment to change the cells themselves.
Understood. All right, very good, Doc. Well, thanks for clearing everything up, and we'll see you next week.